Anyways, my name's Alicia. I'm going to talk to you a little bit tonight about pain points in healthcare. I actually took the assignment very literally, so when I saw pain points, I thought I was show you some pain points from a patient perspective. So anyways, let's get started. As I just said, I'm a 3-time cancer survivor. I was first diagnosed when I was a sophomore in college, and something that I learned tonight already is that I've been a cancer survivor longer than some of our panelists have been here. So I'm a little overwhelmed by that knowledge right now. It took a 3-year period for me to actually finish my Hodgkin's treatment when I was at SU. Went through surgery, radiation, and chemotherapy. And the biggest thing that I think I learned from that experience was in the early 90s how isolating a cancer diagnosis for a young adult could be. And it's very hard to think of life pre-internet, and people get nervous when I say life before the internet. This was, I like to say, I was out in the wilds of cancer survivorship without the internet. Unfortunately for me, in 2004, I had the distinct honor of being diagnosed with breast cancer again on April Fool's Day. And so I don't recommend going to the hospital on April 1st. That's just not a good way to go. Sure. Can you guys hear me now? Oh, now you can.
We love that.
You gotta get that sound first.
Yeah, we love that.
Hello. Is that better?
Yes.
All right.
Much better.
Okay. That just means my scans stay up on the screen that much longer. But anyways, in 2007, my breast cancer actually came back. And if you look very closely, I like to point this out. If you're ever in the Boston area and you're at the Museum of Science, you can go see my entire X-ray history. It's on display at the Museum of Science because they couldn't get anybody else in the United States that would actually donate their scans for a program that they're doing to educate people about the importance of screening and diagnostic tools for all different kinds of cancers. So I was the guinea pig and said, sure, I've probably seen about 1,000 residents and doctors in my lifetime. Sharing my scans with the world is just another way of taking my patient advocacy to the next level. So if you're ever in the Museum of Science, I highly recommend swinging by. I like to call it my wing, but anyways. So another good thing that I've learned, there's 3 phases of a cancer journey. Your diagnostic and treatment section is, I think, the most intense. This is where you're going to get the people doing the majority of the Googling and the looking up stuff online. Your immediate time after diagnosis, when essentially your treatment starts, you're sort of in the routine of what you need to do to overcome your diagnosis, and then long-term survivorship. And I've sort of highlighted this because the longer I go as a cancer survivor, I'm realizing that this is actually a chronic condition, and people don't necessarily like to think of cancer as a chronic thing, but I've been diagnosed with cancer 3 times, and there's a lot of long-term side effects that come with the treatment for the initial cancer. So I'm not trying to step on any other health community like diabetes, which is historically been viewed as a chronic condition, but cancer, I do believe, really, we have to start looking at it a little bit differently. There is an acute component to the cancer where you're actively being treated for it, but then the long-term survivorship is really where we start to see a lot of issues. So, pain points for me in healthcare. Pain points from a patient perspective. Pre-internet, with my initial diagnosis of Hodgkin's, I was really limited to the geography of where I was diagnosed and treated, which was Western New York. It was very difficult for me to find other college-aged individuals dealing with cancer. I would go into the cancer center at University of Rochester, and be the youngest person there by 30 years on some days. And I was very much out of place, very alone, very isolating experience for me during those years. No one liked me. I think you'll start to see a theme between Danny and I over the next couple of presentations. But anyways, another pain point, reduction in support services. Hospitals are cutting way back on traditional social work services. This goes for other healthcare institutions and providers. Your support group, social work, the money just isn't there. So back in 1991, there seemed to be plenty of resources to run support groups, but there were not support groups geared for young adults is what I needed at the time. In the mid 2000, when I was looking for breast cancer support groups, there was nothing offered collectively at any of the hospitals here in the Boston area. So I'm not just picking on one hospital, I'm actually making a statement that a lot of hospitals across the board in the Boston area had cut back on key support services. So this is sort of after diagnosis, how do you get back into living your life? That's when you really need a lot of support. I wasn't getting it from the hospital. And I'm not sure if some of you in the Boston area might remember the Wellness Center that was out in Newton. Wellness Center started closing down. So it just seemed like every resource that I would find, it wasn't too long before they lost funding or were out of business. March 30th, 2008 was sort of a watershed moment for me. I signed up for Twitter. And I did it on a whim. People probably, I had no idea how my life was going to change because of Twitter. Within an hour of signing up for Twitter and being online, I was able to do a search. I put in cancer survivors. Like, of course, that's my context. I come to everything. I'm like, hey, I want to find my other fellow survivors. And I was shocked at the number of people that were very open about being a cancer survivor. It was right in their profile. You know, they had 160 characters, and the first thing right out of the gate was, I am a cancer survivor. And to me, that was revolutionary. It had taken me essentially 15 years to be able to find other people that shared a similar experience that I did. Within 24 hours of being on Twitter, I had connected with 4 other women who had had Hodgkin's as college-age students and that had already dealt with a breast cancer diagnosis. So my population of 1 went to a population of 5 in 24 hours, and I still talk with these 5 women on a daily basis. That, to me, was extraordinarily powerful. I nicknamed my cancer survivors on Twitter my tweet-vivers. You know, I found someone like me. There's an entire community, very dynamic community. Dynamic meaning a couple different things. Basically, you can build it on the fly dynamic, that kind of dynamic, but dynamic as in outspoken and very verbal too. So the other, I say, watershed or Oprah aha moment that I had was in 2010 when I was in the hospital recovering from another surgery. At 2 o'clock in the morning, you know, it's the night nurses are on shift. You don't have anywhere to turn, but I was having a very difficult night. I actually had shingles on top of all this, so I can tell you about that at the other presentation. I felt very alone at 2 o'clock in the morning. I picked up my phone and sent out a tweet and just said, you know, hey, who's on? I'm in the hospital, like, who's still up, kind of deal. And I started getting a wave of tweets from connections that I had made on the West Coast because they're still up, they're still sort of watching the Twitter stream. And I basically had people tweeting with me and sort of providing support for me in a very powerful way at 2:15 in the morning as I'm laying in a hospital bed in Boston. And I thought, this is just amazing. Anytime, anywhere, I now have like this roaming support group, you know, on my phone, and it just, for me, a patient perspective, very, very powerful. Then I began to realize there's communities all around us if we're paying attention, if we're sort of keyed into it. Hashtags define communities. So, you know, today's big news was there's a new pope. You put hashtag #Pope, and you get this whirlwind of tweets of people talking about the Pope. If you're a sports fan and you type in Boston Bruins, you now have this like instantaneous community around the sport, your favorite sports team. Or in my case, it would be Buffalo Sabres, but don't hold that against me. But if you go to Amazon.com and you type in breast cancer, I want a breast cancer book, or I want a book on anything, scroll all the way down to the bottom of the page and look at the conversations that are taking place on Amazon.com, where you would traditionally think, I'm going to buy a book, and the game plan is all there. The community is, there are people interacting, having conversations where you least expect it. And any subject, you can go to any of these sites and begin to see these things. LinkedIn, Facebook, the same thing's happening there. I started really paying attention to how these different communities were sort of coming back into my life, where I was keying into these conversations where they were going, and I realized it was time to sort of formalize a breast cancer community, or a virtual community for breast cancer survivors. And so with another fellow survivor, Jody Schroeder, who I had never met, just only through Twitter, we came up with this idea of creating a breast cancer social media community. And Twitter was our platform. We took inspiration from the healthcare social media hashtag. We had been participating in a weekly sort of Twitter gathering, talking about healthcare and social media topics. And Jody and I had talked numerous times on the phone about how engaged and sort of fired up we were when healthcare social media had a topic that was relevant to patients. And we really said, you know what, it's time to sort of spin off our own community, and let's see what happens. Let's see where this goes. So the BCSM tweet chat was born. We have met virtually every Monday night since July 4th, 2011, so we're coming up almost into our second year. We have a different topic every week. Our participants include patients, physicians, psychologists now. We've attracted a lot of attention from the social work community. Stanford University now has somebody sort of monitoring our Twitter chat every Monday night. So there's a lot of different people that are lurking. We don't have stats on lurking, but we certainly can tell how popular a topic is based on the amount of email we get the following day from social workers, psychologists, doctors across the US that want to know, how do we build our own tweet chat? And it's a very interesting idea. So essentially what we've done is we've taken a hashtag, this idea of creating a dynamic community, and we've formalized it with this hashtag BCSM. This is a snapshot of all the BCSM participants from last Monday's Twitter chat. I think there's 100 or 174, I'm not sure. We'll get to the next stage. But if you go to simpler.com and look up the healthcare hashtag project, you'll actually see there's other kinds of, there's a diabetes community now, there's a cancer community, there's a brain tumor Twitter chat that's just started up. So basically, if there's a disease state, there's a corresponding Twitter chat that goes with it, most likely at this point. They have been kind enough to help us track our chats and create, yes? Okay. They've been very kind to help us snag analytics from these different things. So we have a very good idea of how we trend from week to week, and we just keep going up and up and up, which is absolutely amazing. How about?
Can you give us a sense of some of the topics that you've discussed over the past 30 days or so, over the last?
Yeah, sure. We talk about everything.
Nice.
Yeah. We talk about survivorship issues, so we've focused on making simple changes in maybe diet, simple changes in how you exercise a little bit more. So, you know, obviously the basic conversations that you have. We also talk about how when you finish a diagnosis, how do you sort of make your way back into the workforce, or if you've been out of work for 3 months dealing with a diagnosis, how do you get started, or how do you approach coworkers? How do you talk to your family? We basically run the gamut. Just as a side note, and I wasn't really going to get into this, but I think you raised, talking about the topics brings up something that was very, very difficult for us. Online, there is a great number of women with metastatic disease, which is the stage 4 breast cancer. I did not have stage 4. I do not. Never had metastatic disease, but this Twitter chat in particular has attracted a lot of metastatic survivors that are looking for resources. And we, last year, on February 11th, we actually lost 2 members of our community on the same day. And it was a Monday. And I was on my way to work and my phone started blowing up. I'm getting text messages from numbers I don't even know. And we realized that we had lost 2 women that had been coming to every single Twitter chat that we had had. And I think it took me a little bit to realize this was a topic that we hadn't really talked about yet in this group. And we decided to go ahead with that Monday night Twitter chat, which was very difficult, but it ended up being almost like a virtual memorial service in a way. And because of that experience, we have visited the topic of death and dying quite a bit, for hospice, palliative care, topics that I think never in a million years would I have been the one to suggest those. I think sometimes as a cancer survivor, those aren't the areas that you really want to talk about, but as for the community, I think we've learned a lot on how we can help each other be better cancer survivors, more supportive for people that are going through metastatic disease. So I don't know if that answers your question.
Yeah, it does. Thank you.
Yeah. So quickly, here's just some stats. Again, this is just a snapshot of one Twitter chat. So I'm Stales, by the way, so that's my little icon up over there. But within a period of 60 minutes, my username was mentioned 227 times. I was able to fire out 94 tweets, and I made about over 600,000 impressions. And I get the sense that this crowd will probably ask me what that means, so I'm going to just offer it up right away. It's not exactly exact science, but impressions, the way that these are tracked, it's the potential for people to actually read the tweets that I'm sharing over that 60-minute time period. So I had the ability to share 680 some odd thousand times using the Twitter platform. So I can give you a much better in-depth definition after I'm finishing here, but I don't know, maybe for some of our marketers on the panel, that's another little channel that I think needs to be checked out at some point. But, so here's our lessons learned for BCSM. You have to be consistent. You have to share the work with a team. Make sure that you can't just show up and like, hey, this isn't a free-for-all. We actually announce a topic ahead of time and the content in advance, so the people that might want to join us have an idea of what we're going to talk about. The community polices itself. So if you sign on to Twitter and decide you're going to spam the heck out of our hashtag while we're having a conversation or a little, virtual meetup, the community will take care of it pretty quickly. Zero tolerance for disrespect. We've never really had any issues with that at all. We do allow for disagreements, but there's no attacking each other over Twitter or any of that craziness. And respect differences. What we've learned is this is a global community. Anybody can see Twitter. Anybody that's got access to Twitter can join our community. We have people from all over the world. We have people in Switzerland and Italy and the Middle East that actually stay up. So it's 3 o'clock in the morning, their time, that get online to join the conversation. And some of the things that we've learned is breast cancer is shunned in some communities across the world in ways that we can't even imagine here in the US. So we have to be respectful that if somebody is bringing an issue to us about the way that they're being shunned in their community, we have to understand that just because we're here in the US, different rules apply, and different mentalities are in force around the world. So here's my 5 big things that I hope you remember. Commitment, consistency, transparency, empathy, and respect are the best ways for building successful, patient-centered communities. I think that's it. Yeah, that's it. Any questions?
Is there anything you do to sort of promote these chats or sort of get more people to join in?
Yeah, actually, we sort of have done the reverse. Everybody else sort of like builds a website and then like creates these other channels. So we've done a total 180. We started out as a Twitter platform. We built a Facebook page when we realized that Twitter wasn't enough. And we just rolled out the bcsmcommunity.org. So we actually have a website now where people can sign up for reminders about the Twitter chats. They can use that. We blog the topics and the content there during the week. So that's another way that we've been promoting this. We have held meetups, offline sort of networking. Deanna Atai, who I neglected to mention, she's actually a breast cancer surgeon based in Los Angeles, and we've sort of brought her in as a moderator so we have a physician that sort of watches over everything that we say, and if somehow we get going down a path that might not be the best information, she wheels us in. But she hosts a lot of meetups on the West Coast. I host meetups on the East Coast, and Jody's based in Texas, so she's sort of got the Southeast, back up there too. So that's how we promote it. But we've never done a formal marketing campaign or anything like that. It's all virtual.
I wonder if you could talk to us a little bit about the different ways that people are using the community, the tweet chat.
Mm-hmm.
Do you have a core group that's of one size, and then you see other people come occasionally? Do you have any insights on that?
There is definitely a core group. I'd say about 100 members that show up religiously, and we can go anywhere from plus or minus another upwards of 100, I'd say, people, depending on the topic. We have a lot of people drop out or won't attend topics or nights that we're talking specifically about metastatic disease. So we see a lot of people still shy away from what I'd call the heavy-hitting conversations. Mets, palliative care, hospice, but we do, once a month we talk about just general survivorship issues, and that's always our most attended conversation.
Is that wondering if there's a carrying capacity, if there's a right number of actual active participants for it to be meaningful during the time period? Because could you support 1,000 people actually tweeting?
It's a tough tweet chat.
Yeah, I mean, just in general, the tweets right now, we basically lob the questions out, and the tweet stream goes bonkers for an hour. And our best tool has actually been the gems that we get doing a transcript analysis the next day. So we always take the transcript and post a recap for people that miss it, because you get people like peeling off into side conversations all the time. So but I mean, is there a threshold where this no longer works? Yeah, probably. I'm sure we've hit it on a number of occasions, but we always are mindful that we go back, sort of pull those little diamonds in the rough, if you will, out to represent to the community as a blog post or an email newsletter to keep things going that way. So that's a very great question. Thanks. Anybody else? Yes.
It's a really naive question, probably, but I think this is such a great service, and I can see how there's so many uses. I work with cancer patients. I'm wondering for you, since it's so involving for you, are you able, or are you trying to derive an income from it?
Of course. No, actually, that's one of the reasons why it is time consuming. And I think when we initially started this back in 2011, I don't think I could have ever imagined the success or the popularity. And we've done some we've had a lot of angel investors, I guess. I don't even know how, I'm not in the lingo, so I really don't know, but the people with money emailing us and saying, you know, we want you to come down. I've been down to New York 3 or 4 times in the last 3 months talking about ideas, basically how to create a model out of this that could not only go for breast cancer, but Hodgkin's lymphoma or brain tumor, whatever. So we're constantly behind the scenes sort of tweaking this community. Our first step was launching the website as an additional source. We're actually in the process right now of establishing a 501c3. So we took a hashtag and we basically made an organization out of it. But yeah, I mean, I appreciate the thought, but we're definitely, that's the path that we're trying to go down. Because if I could walk away from what I do for a living to do this full time, absolutely, I would do it in a heartbeat.
Do you have any associations with the Cancer Society? Are they supporting you? Or?
Well, since you asked, American Cancer Society, no. Susan G. Komen, definitely not. A lot of the breast cancer focused foundations don't like what we're doing, basically, because we're independent. We're not tied to a pink ribbon. We're not out there raising money for Susan G. Komen organization or anything like that. A lot of the women that are participating in this chat, and I should say there are some men, breast cancer survivors that have now joined us. We're very wary of what's happened in the pink community, and we're all essentially burned out at how Avon and Susan G. Komen and some of these other big names have really gone after each other, competing for dollars. But when you actually peel into their annual reports, the amount of money that's going toward research or even patient care is minimal. When I was, and Bob, you'll probably remember this, when I did a writing project with We Go Health a couple of years ago, and one of the things that I did was dig into what happens to the money that they raise for some of these organizations, and I was shocked that less than 17% across breast cancer organizations actually go to research or patient care. To me, that's disgraceful. We've had a lot of emails from Susan G. Komen saying, you know, we'll sponsor you, but but of course it's got to run through our site, and we're not going to sell out for a quick buck from Susan G. Komen or any of these other guys. And that's public knowledge, so I mean, anybody that asks me, I'll share my opinion. But so we're sort of the lone wolf in in particular the breast cancer community. But I'm very proud of that, so I wear that with pride. Yes.
As the founder of this group and this tweet chat, and also as a participant in it, what is your feeling when a non-patient participates, whether it be a company, a hospital, another organization?
Great question, actually. We have a lot of non-patients, I guess, if you will, that do participate as caregivers for, we have a lot of husbands that join the Twitter chat that want to find out how can I best care for my wife, or we've actually hosted a couple Twitter chats specifically for guys whose wives are going through breast cancer treatment. So we're a very open community. The only thing that we do ask is if a company is going to join the Twitter chat, that they identify the person so we know who we're talking to on behalf of a company. And we make it very clear that we have no funding, we're self-funded. We don't take any corporate money at all at this point. And if they're going to join the chat and use the hashtag, they can't publicize their drug. We had a lot early on with some of the breast cancer drugs, the Twitter chats, that all of a sudden we'd start to see they would basically fire up their Twitter stream at like 9 o'clock to let us know that, they got a new generation of, their breast cancer drug or out on the market, and we shut that down right away. And we just basically, we're not giving them free publicity, which, and the community is very vocal about whether or not they've had good or bad experiences with drugs. So we do occasionally get companies that want to chat, but when we ask them to be open and transparent about who they are and what they want to talk about, they usually disappear. So I think that says a lot, unfortunately. All right. Thank you, everybody. Come get this.
Thank you, Alicia. That was quite a personal story. Talk about transparency, having your skin at the Museum of Science. Can't be more transparent than that. Well, when I was listening to your speech, I was thinking to myself, I should keep using Twitter more often. You build an army behind it.
Yeah. Secret weapon.
Yes. Well, our next speaker is Danny. Danny has a master's in public health and is a registered nurse. Danny is also a patient suffering from multiple sclerosis. Danny is a caregiver, a nurse, and a leader. He's been a senior project manager of patient family experience for Boston Children's Hospital. His rich and varied careers include experience as a nurse, QI director, health informatics specialist, author, and researcher. Please join me in welcoming Danny.
I will respond. Yeah, I think I won't be that long. There isn't that much time, so I'll stay right here. How's that? So, let's see if that goes up there. Oh, shucks. Yes, okay. So, I don't know, this is my 4-year-old grandson. I don't know if you can tell, but he has a dinosaur on his shirt. So he knows a lot about dinosaurs, and I'm the problem Okhla. And so I say to him, as we're talking about dinosaurs, that his aunt is an herbivore because she doesn't eat meat. And we had quite a little disagreement because he said that she's an omnivore. And I'm like, no, she's not. She doesn't eat meat. And he says, but Opa, she can eat meat. And he's an expert in dinosaurs. One of the things that interests me about social media is it's like drinking dirty water out of a fire hose. There is so much that, how do you know? Like, you know, there's so much out there. How do you, you know, figure out what you're gonna, what you're gonna use, what you're gonna go for? And so, so this experience with my grandson is really, I mean, he's an expert. Now, I am first and foremost a patient, and I'm a nurse, and I know that, you know, there's expertise is everywhere. Now, there are different types of expertise, and there's different qualities of information that you can get. And even the things that are like, you know, double-blind studies, which is supposed to be the highest quality of information, really has its own limitations. And so me as a patient, how is it that I find expertise? Now, I was terribly intimidated by social media. And really, I dabbled in it, you know, like 5 years ago, and, you know, I just like looked at the stream of consciousness crap that I looked at, and I thought, you know, I do not need, you know, fast stream of consciousness. It was like not helpful to me. So I did an experiment, and forget it. Anyway, so then really, when I was working at Boston Children's, and one of the things we were trying to deal with was the dilemmas, healthcare is production work, and but it involves individuals, and so the ability of people to improvise over the production is really a challenge, and so there are so many different dilemmas that happen. And so I was working with the people who supervise the front line at the front desk. And it was just like kind of amazing what they had to deal with. And, you know, we really didn't have any like just-in-time solutions for these unique dilemmas that people had. And so one of these bright young people said, you know, we really ought to have a hashtag that's specific to us, so that when something happens, I can just tweet it, and, you know, my colleagues can respond, and maybe supervisors could, you know, take turns overseeing it, so that when there was a dilemma that you know, we couldn't handle right away, they could, like, you know, deploy and help out. Well, it was like an amazing idea, and it made me think, well, I really better get more involved in this. The sad part of the story is we never did it because it was too out there. But it was a great idea, and it motivated me to become friends with social media. Now, so I'm a selfish guy, and so I use social media because there's stuff I care about. And you've already heard about communities and how you get to all that, so I'm not going to go in that again. But the other thing I am is I'm a change agent. I really want, I just can't help myself. I am wired to, you know, maybe it's why I became a nurse. There's a problem, and you fix it. And so I'm really intrigued by, you know, how is it that you use social media as a change agent? Now, you know, so I've identified, you know, different groups through social media, the Society of Participatory Medicine, patients like me, different, anyway, but you know what? They're mostly talk. And I don't want to minimize talk, because talk is huge. And developing communities and for talk is like, but so here's where I'm kind of stuck today, is my dilemma of the moment is, how do you use social media to move the dial in a system? I'm a systems guy, that's how I think, I'm a change agent. And so what does that mean? That means I think about, what does it take for a small intervention to make a large difference? And so I'm struggling with, how do you use social media as a tool in trying to affect change? Now, I'm really good at one-on-one, or I'm really good in wide groups, and that you bring people, I've always been successful. I sort of cherry pick who I want to work with wherever I am, because they're people who I think are cool and have good ideas, and I like variety, different brains and different skills, and I bring them together and we accomplish something. And I'm really good at managing time and getting something done. But I don't know how to do that so how do you leverage this massive, these communities that we're talking about, and how do you do that to then affect change in a system sort of way? So I have 3 or 4 more minutes. So I'm asking, in your experience and what you've heard about, how have you heard, or how do you see, or how do you imagine that social media can be used to affect cultural change in wherever it is that you have a passion? For me, it's healthcare. What's been your experience? Yes.
Well, for me, I see that it breaks down stigma. In my case, and in people that I work with, I see that first time that you go online and divulge the diagnosis that you have, an entire new world opens up for you. And there's a whole movement of people that have realized that and are starting to understand that HIPAA applies to organizations. It doesn't apply to me as an individual. And once I can open up and start talking about my experiences and what I have, then you meet other people who have the same thing, and it again, it opens up an entire new world for you and takes away a burden that you don't need to carry as an individual.
So then you've identified this group of people, whether it's 5 or 1,000, and then you want to accomplish something. We're a group here that is working on startups or whatever, and so you've identified a few people and you're working on developing a product or an idea, right? But and that's done a lot live. So take that the next step. Now that these people have disclosed and they're comfortable and they're part of a community, how do you leverage that for action?
Well, one way from a product standpoint is you get chatter built up and you have people talking about their experiences. So you have people talking about the side effects they're dealing with. Kind of the patients like me sort of model is you have people out there talking about what's going on with them, and things that any researcher is not going to necessarily be able to understand what's happening in people's daily lives. And all that chatter becomes part of this massive network of information. It's all that big data that people can start to look at and start to understand not how to treat someone with cancer, but what it's like to live with cancer and how to support
So you're
someone.
sort of pointing to what your Tuesday task, after your Monday, which is collecting and categorizing the information and then sharing it back out. So that, okay, okay. Yeah, that's very cool. What else? Anybody else have thoughts?
I work for a company that sells a medical device focused on stroke survivors. So social media allowed us to better communicate with our, I wouldn't say just customers, just our target audience, if you want to use a marketing term, on the marketing side of it. So we have feedback from users. We have users or stroke survivors that are, instead of just texting us or emailing us, they'll go on our Facebook page and say, is your device reimbursed? What does it do? How does it, so it gives us that two-way communication street that we want to have with our patients. And then we have patients writing good things about us. There are patients that are writing their experience with their device that if it's not very positive, it gives us the ability to address them on one-to-one basis where our support mechanism kicks in. We call them, we email them, say, what are you having difficulties with? So it's really changed that. We still practice an integrated communications campaign where we touch them in a number of different ways, but social, it gives us that ability.
So, Laura, you were talking about one of the things, and yours, the coolest thing I think in your presentation was Texas something who you looked at feedback about their services, and then the nurse, the lead nurse, was about monitoring that, and that motivated her to what to pay attention to. So I think that's an example of it. I'm looking at the time, and I see that I don't want to keep you over your 8:30, and so I thank you very much.
Well, thank you for sharing your story, Danny. Well, I would like to open up the floor for questions. If you have any questions you want to ask the panelists, please feel free to do so. Any questions? Okay. Well, I would like to thank Jay, Laura, Alicia, and Danny for being the panelists. And I would also like to thank the two volunteers. Rachel, please come up. And Michael, please give the panelists and the volunteers a big round of applause. It takes a lot of effort to run events, and we're always looking for volunteers. So if you would like to participate and make this event a bigger and a greater event, please come talk to me after the event. And we host our meetings every month, second Wednesday of each and every month. Our website is painpointsinhealthcare.com, and these are our previous events. The unconference style I talked to you about is this one, where you see these sticky pads attached to the wall. These are the problems we're trying to solve as a group in these meetings. A lot of cool companies come out of these meetings, and the company I'm working on right now came out of this meeting as well. The month of April, it's going to be an unconference. In the month of May, it's going to be a conference, and the topic for the conference is mobile technology in healthcare. That is our May's event. Finally, I want to tell you a story. And in my meeting, there was this elderly gentleman. I know I'm talking elderly, I mean, it's all the baby boomers, that's where the money is, from the healthcare standpoint. This elderly gentleman was not able to hear for many, many years, and he went to the doctor and he said, "Hey doc, I can't hear." And the doctor fitted him with the latest hearing aid, and the patient said, "I can hear perfectly." And the doctor said, "Come back in a month." So the patient came back in a month for a visit, and the doctor said, "Your hearing is perfect. Is your family very glad that you got your hearing back?" The doctor asked. And the patient said, I didn't let my family know that. I just sit around and listen. I've changed my will 3 times already." Well, I want to thank you so much for stopping by, and have a good night. Stick around and build some relationships and network, and have some healthy food in the back. Thank you so much, and have a great evening.
Screaming.